Hey everybody, it's Dr. David, the ENT doctor. I have posted a link to an editorial on a recent paper, which upon reading both really has indicated to me that what I have been doing needs to change. And this is in the context of using nasal steroid sprays in people with upper airway obstruction, in particular children. Now, these sprays have been advocated for trying to shrink down tonsils and adenoids, and it's been well shown well before now that that just doesn't work in the way that we want or need it to. So that's not really a protocol I've really adopted or followed because the research didn't advocate that it was a good idea in the mainstay. What I have been doing though is using these nasal steroid sprays when it comes to swellings within the nasal passages called the inferior turbinates. And when identifying that they are large, trying to shrink those down. And whilst I think these medications certainly play a major role in managing people with allergy symptoms, of which one can be swelling of the turbinates, I've had to sit back and look at my numbers and look at how many of these large turbinates that I'm seeing actually have an underlying allergy, in which case the spray would be worthwhile. And to my surprise and probably disappointment in having been pushed in to do this, is that these patients did not have a lot of allergies running through the system. So the context of all this is that these nasal turbinates have just grown too big. And whilst I will not stop using these sprays, I will have to reconsider my approach. My strategy in the past had always been to try these sprays for about 3 to 4 months, then at a clinical review determine whether they were working or not. In the meantime, if the child was old enough, I would also organise some allergy testing to see if we need to get an allergist on board. What I've reflected upon looking at this paper and the editorial is that, and I know this myself, is that children with airway obstruction need to be fixed sooner rather than later. And the sprays aren't always going to work, and sometimes the children aren't going to like them, and sometimes as a result of that, they're not going to take them. Which means that 3 to 4 months is lost time and opportunity in terms of getting these children better. So this is a pivot for me in terms of how I'm going to approach things. And in the mainstay, I will still screen for allergies in terms of asking about them and making a clinical assessment to see if that looks like an allergy-related swelling of these inferior turbinates. In the circumstances where that seems to be the case, then I will still lean towards these nasal steroid sprays. If, however, there's no clinical suggestion, either on history or exam, of an allergy leading to the enlargement of the inferior turbinates, then I'm not going to burn through 3 or 4 months of waiting and seeing. I am going to take on board the feedback and information that's in this editorial and research paper with respect to getting on to a more proactive and more immediate approach in terms of relieving the airway obstruction of these children with surgery. And in the process of doing that, again, I will keep screening for allergies because I have been caught out where I didn't think it was an allergy, but it was. But it's time for me to accept that, conservative as I might want to be in some respects, I'm also proactive in many others. And the balance of that really has to come to outcomes. And as this paper said, these children had marginal benefits. And I guess, to be fair, they didn't clarify what the obstructive pathology was to the fine print that I probably would have chased down. But regardless, the outcomes were not adequate. The children were struggling, and that doesn't gel well with me. So, as is often my quest in life, I want to find out where I'm wrong. And I don't do that to beat myself up. I do that to make sure that I can be better. And it's no good me knowing something and then not acting upon it. So for those of you that are watching this who might happen by circumstance to have been through the clinic already and have been started on these sprays, please don't stop, please don't change, just stay the course. There is going to be a little bit of a, I guess I call it a washout period where I transition from things. So people that are already on the pathway I've set will just steer that course. But for everybody new that comes along, we will be having a different conversation. We'll be having a conversation that will centre on whether there are nasal allergies present or not in terms of the symptoms and findings. And in the situations where there are not, I'm not going to be advocating these sprays as the only option to try first. I'll be putting all the options on the table so that things are made clear, because it is my responsibility to use this information to help the people that seek my help. That is my job, that is my role. It is not for me to continue on a pathway that I feel is wrong when this really is just staring us in the face. So as to everyone else that might be watching this, as I always say, this is just purely information. This is not advice, but it is something that you need to discuss possibly with your treating clinicians, especially if your children are being managed with nasal steroid sprays, particularly in the context of tonsil and adenoid problems with airway obstruction, more so than hay fever type issues, because that's the context of this paper. And it's possible that not every clinician has seen this paper yet. I've only just seen it myself, and that makes it pretty fresh and new. So it might be something that they will need an opportunity to reflect on as well. So that's me in a nutshell. I'll share more information as it comes to hand, as I always do. But as I said, I think when mistake is potentially going to be made by ignoring this information, well, that's not the road I'm going to walk down. So I just wanted to share that with you all so that you can see that I am quite humble when it comes to new information coming my way with respect to realising that it needs to institute change where those changes are clearly necessary. And this is certainly where we landed. Cheers.